Oh, right,
Good
right.
morning, John. How are you?
Your church or whatever. This is important information to get out. What happens if you get a COVID-19 positive case? So let's just jump right in. I'm not getting to move it. It's not moving for me.
Okay. It says you're controlling my screen.
I am?
Yep. Try it again.
Okay.
Oh, there you go. Look at that.
You know, this is what happened the last time. There's a long delay when I do it. So I just have to be patient. Okay. All right. So
there you go.
Okay. There's a couple of objectives in this talk. And the first one is to go over what COVID-19 is, because it's been around here now for getting on a year, but we've learned some new things, and then we have to remember some old things to do this right. Discuss some strategies, building plans, and how effectively to communicate with customers and the community, because this is really key. Knowing that transparency is how we're all going to do well in this, I think is important. So let's just get right into some of the basics. So I pressed it and it's just not going. I'm going to try again. 1, 2, 3.
You know what, Mary? I got it.
Yeah, I think my bandwidth is so slow that sometimes it doesn't. We did this the last time. We gave a lot of talks about how to reopen your business. Do you want to still go around and ask everybody what their business and their concerns are? Because I think that really guides where we go on this talk.
Yes, I think we do. I think it'd be great to actually hear from everybody who's on the phone and understand sort of what their perspective is.
Okay, so let's go down the list. I see John. Do you want to start off your name? What
you're here for? John DeGruin, Windermere Vashon. I'm still on the board with the Vashon Chamber, and I'm also involved with Vashon Center for the Arts. I'm president there, so I'm here in multiple capacities. I have a fishing boat up in Alaska, Primus, and that's a totally different situation. So what else? That's it.
John, you need to do a few things, less things.
I need less, yes. Soon.
Just the chamber board has to be one of them, just saying.
Yeah.
That you're doing.
I like the chamber board and I like the Vashon Center for the Arts, but I'm involved with other things too. So everybody gonna go.
Well, good. But you're gonna find out there's a lot of gray areas in all your things, but we're here to help. So we've got some ideas for you, but good.
Good.
Is it Vicki?
Aaron.
Oh, Aaron.
Oh, Vicki, go. Why don't you go, Vicki?
Okay, I'm Vicki de Monterey-Richoux, the president of Vashon BePrepared. But more importantly, I'm on the team with the Emergency Operations Center that actually helps businesses respond, at least peripherally. Obviously, the doctors and Rick Wallace, who's a wonderful PR champ, do a lot of the work there in the front end. But I'm involved at least in a backup capacity and monitoring and so on. So I wanted to understand what businesses are seeing.
Great. We're going to be talking a lot about the support you're able to give.
Aaron, I know you're on there. Aaron.
Okay, hi, I'm Erin Keeper. I'm with Vashon Adventures, and we have the kayak and paddleboarding at the boathouse at Jensen Point, and we're in the process of building our new bike shop in town. So we're kind of in our quiet season right now, but you know, all the work that you guys did over the summer, and Mary, your previous work really helped us have a safe season. So I'm really appreciative of that. And I just want to keep learning so that, you know, when we do open back up, we're doing things well, and hopefully none of us will get it, but, you know, we're trying to just be on top of all of this. So thanks for all you're doing, you too, Vicki and Cheryl and everybody else.
Well, thanks, Aaron, for those kind words. And you're I love the fact that you're in front of this, and you've done an excellent job. Excellent.
And then I think we have Ellie, is that, or Eli, I'm not sure.
Hi.
Hi.
It's Ellie.
Oh, sorry, Ellie.
No problem. Yeah, I'm a solo practitioner actually at the Chamber building.
Yep. Oh, yeah. Okay. Sorry, can't see your picture. So it's nice to see you now.
Hold on. Let me. Yeah, we ran into each other a few times. There.
Yep. Glad you could join us.
Thank you. Yeah. So actually, right now I'm dealing with this because my wife tested positive, though she has no symptoms. So as a result, and I turned out to be negative. I have no symptoms either, but I had to shut down. So just so you know, it's quite and not just shut down. I'm basically on lockdown, which, you know, there's some parts of it. I mean, I totally agree with, but some of it I'm a little bit confused about the length of time, at least on my part. So because anyway, the testing is interesting. You get it one day, but really the positivity or your exposure is 3 to 5 days before usually. So we're now looking at about 2 weeks, and I'm still in lockdown until next Monday. So I am really confused. So I'm kind of glad that I think there's Vicky. There you go. I'm glad Vicky's here because I still want to understand some of the logic of all this. But anyway, I'm doing it no matter what because that's the safest thing to do. Though King County is just, I mean, not King County, CDC has just changed some of their requirements. And I don't know, King County and Washington State, I believe, are following some suit soon, but still want us to do what I'm doing, which is basically about 3 weeks.
And we'll go over the changes and that and what the current recommendations are and kind of why CDC did it. But I'm going to tell you up front, most of us are still saying 14 days because it wasn't that any data changed. No data changed. The data still strongly says that, you know, you can still be negative at 7 and positive at 10 days or out or 11 days out. But it's a less likelihood if you're not, you know, as you go further out. But the sad thing is a lot of people wouldn't do 14 days. So they backed off and they said 7 with positive testing, but we'll go over that.
Okay, great. Well, yeah, that's what I found out just talking to looking into it. But so I'm doing the full thing and it's, you know,
it's not fun. I know. I'm sorry. I really.
Well, you know, it's just, it's taking a toll, right?
Well, and I hope your wife
sorry for your wife too.
Well,
I hope she stays non-symptomatic.
Well, she's out by Wednesday, so she's out before I am. That's the thing that gets really strange, right? Just so you know.
Yeah, and we'll go over why there's that leg time.
Okay, thanks.
Okay, good.
Okay,
good.
let's take it away, Mary.
All right, let's go. Next slide. Okay, this is just me, who I am. If you don't know me, I'm fairly new to the island. We've been here. We found the place 5 years ago last month and just fell in love with the island for the one main reason was we love the community. We came up here permanently about 3 years ago. I'm a retired pediatrician. My subspecialty is, my fellowship was in immunology, rheumatology, but then I went into neonatology, so I covered the bandwidth. So that's who I am. And this year has told me again why I love this island, because the community is so strong and it's such a great place to be part of. So let's get on with the talk. What if one of your employees or your customers get COVID-19? I want to change this a little bit. There is a chance. There is a huge chance that you will get COVID-19. So let's change this into what happens when you get it, because it's out in the community. It is an illness that can be spread without symptoms. So as much as you try to do everything, there's people out there with no symptoms spreading it because they don't know. So it's likelihood more of us will get it, and we're going to have to go through this procedure. So assume you're going to get it and prepare as such. Next slide. Okay. Assume everyone has COVID-19. I was just with somebody the other day and they said, oh, don't worry about me, I'm fine. And I'm going, well, I don't know you're fine, and I don't know I'm fine, so I'm going to continue wearing a mask, and we're going to continue to 6-foot distance, and we're going to continue to wash hands. We want to be negative. We want to believe we're negative. We want to believe our friends are negative, but you know what? We don't know that. So the best preventative care is to assume everyone's positive, even without any symptoms, and go with that thought and wear a mask, socially distance, and wash hands. That's our guiding principle. And we got to keep telling ourselves to repeat doing that. Next slide. You know, I don't know if I have a delay on my end because, okay, good. Okay, this is just a quick and dirty quiz. If you have COVID-19 exposure in your business, what is the best course of action? You know, let's just yell it out if you got these answers. Do you think assume it will not impact your employees because you're having them wear masks, wash their hands, and take their temperature every day before you go to work? Do you assume it's not going to happen because you're doing everything you should be? People say yay or nay.
It may happen.
Yeah,
We've got to, you know, because we're Windermere Real Estate, we're a franchise. Windermere Corporate has come up with a plan for us, and so we follow that plan.
You know, you're right. It may happen even if you're doing everything right, everything perfect. You don't know because it's those non-symptomatic people that can still be out there spreading it. So assume you will get it even though you have all these safeguards in place.
Well,
but by having your safeguards in place, you're going to be much less to spread it, get back into your offices faster, and you're going to do so much better if you have the preventative stuff in place. But you still may get it even if you're 6-foot distancing in that. I'm sorry, Eli, did you say something?
well, you know, like my
Really?
case in point, like nobody in my nobody in my practice got it. I didn't get it actually, and I'm still shut down. So it can happen, right? It could be your boyfriend, girlfriend, wife, whatever, you know.
And the beauty there is that those places that have gotten it on the island, because they had such strong procedures in place, that spread did not occur. So keeping spread from occurring is the best thing you can do. Because you can't guarantee that you're not going to be exposed to it because it's invisible and there's no symptoms in some of these. So yeah, I agree with you. I'm sorry, Vicki.
Yeah, I just wanted to ask if you were going to cover relative viral loads, because
Yes,
obviously it's a
absolutely.
lot lighter with masking.
Absolutely. Okay, B, assume it will not happen in your business because you have signs up and monitor your customers regularly. Well, signs help. I love the signs. I think that's a good remembering thing, but it doesn't guarantee anything. We just have to remember, read the signs and follow them. C, tell your sick employees to stay home until they feel better. I'm going to tell you, I come from Ohio and I still have family back there, and they sent me a video of something that happened. They sent some college students home to their frat houses, and because they were positive, and the police got called in because they were having a party. And on the second day that the police were called because they were having a party, more than the number of people they should have there, one of the police came back and said, oh my God, you have a positive. You have 2 positives in the house. You shouldn't be having anybody there. And the guy says, yeah, I know. They sent us home and said we couldn't leave the house. That's why we brought the party here. So, you know, we've got to tell people, we got to explain things. We are quarantining you, or we're isolating you from other people. We're not just sending you home. We are telling you, you have to stay away from other people. This is where I couldn't believe, I still don't believe those junior college students were that dumb. But my sister swears by that they didn't understand that they weren't allowed to have people at their house. But we really have to be clear and tell people you need to isolate. This doesn't mean you can be in the same room with your spouse or your family members, or you can bring the party to your house. You need to be isolated from the other people until we, 1, know you're negative, or if you're positive, until you follow all the recommendations, and we'll go over those. So we have to watch our words. That's why I put this in there. We have to make sure we understand. If I tell somebody to go home until, I get it, but apparently they don't. So we've got to be careful and really be clear what we're thinking comes out in our words. So D is the right answer. Is create a business continuity plan just in case someone gets it or is exposed. Get a plan in place. That's going to be a big thing for you. That really is. That's going to, it'll be something to go to hang your hat on, and we'll go over that. Again, consider every employee to be infected and that they can spread the virus. This is an asymptomatic spreader. We do know you can spread it, and we'll go over viral load later, much more if someone coughs in your face and that. But we're hoping if you have a cough, or if you have shortness of breath, or you have one of those signs and symptoms of the virus, that you're out of the community. You're not there spreading it. This is really to contain it. We've got to watch for people who are asymptomatic. So next slide. Okay, so I'm a big football fan. The best defense is a good offense. Really getting out in front of this, knowing what we're doing, being prepared is the key. And the way to be prepared is to have an offensive plan. And I call it a 3-part strategy, or the 3 legs on the stool. The first one is to go back, review and revamp all our safety protocols. Is something up new, or are we doing everything right? Do we get sloppy? Do we forget something? Revamp everything. 2, I call it create a COVID team. You really need a team in your business. If you're the owner of the practice and you're the team leader, try to give somebody else some of your other jobs, like taking out the garbage of that, so you can really put time into this team. And we're going to go over each one of these strategies. And the third one is, if you get a positive, when you get a positive, follow the current King County and state of Washington guidelines, which you're going to see they can change. So when you create your team, you're going to have a team leader, and they're going to stay on top of things. So here's the best news I can give you. And whenever I gave a talk in medicine, it was always, you wanted 3 things to, if they left with 3 pieces of information that you talked about, that was the key. That was a successful talk. So I'm going to tell you, this is my number 1 of 3. So I will be repeating this one. The good news is you are not alone. There are people here to help you. If you have a positive case, there are people here to help you. Vashon BePrepared, the Chamber, and Medical Reserve Corps. And the next thing is what I want you to write down. Next slide. And that's why, Vicki, it's so important. It's a phone number. This is the phone number that if you get a positive case, you can call this number. If you have a question, you can call this number. This is such a gift that is on this island from Vashon BePrepared and Medical Reserve Corps, that you can be talking to healthcare providers, professionals, people who understand HIPAA and confidentiality, but also understand you may be in a job that you are black and white. These are gray things. There are gray zones in here, and you're not going to know, where do I fit here? How does this? They're going to be there to talk you through it. They also may be the person who you call and say, well, we had this positive and this positive, but here's all the information I can give you. They're going to ask you more questions, and they may say, you're fine. You're good to go. You've done everything. You're good. You're fine. So don't always think they're going to give you bad news. They may give you support of good news, but this is the key phone number. And I am so excited that the Reserve Corps is here to help everybody. And they've already been doing great things. And you'll hear about that later in the a video that we've got. But this is number
Mary,
1.
One thing I would just add about this Medical Reserve Corps, this isn't some big King County entity. This is a group that's focused on Vashon and what our community specifically needs. And, that's something that's pretty special, just a side note.
These are all volunteer people who are out there who have volunteered their time to follow the numbers, things like that. And I just think that is a load off of a lot of shoulders, because if you're a massage therapist, this isn't how you think. But as a physician or a healthcare provider, I do think gray all the time. If this, then do that, what is the purpose behind this? How are we going to get around this? And they're here to help. So So that's number one. So now going back to that three-legged stool, the first one was review and revamp your COVID safety plan. We made up this employee expectations and your customers in your workplace when we gave all these talks earlier. Go back to it, look at it, see if anything's out there that may have changed, or, ooh, we kind of got sloppy on this. Make sure you have everything in place because the numbers are going up. They're going to continue to go up. These are going to be even more important. So review your safety plan, maybe have a fresh set of eyes to walk through your business or that, or call that number or talk it through. I got a lot of phone calls over the summer from businesses. I loved it because everyone who called me wanted to know how to do it best. They wanted to do it right. It is so exciting to be around people who want to do it right. And so I would just say, review it, get good. Also, you may have new employees that don't know some of your plans, things like that. So go back over that. Next slide.
And Mary, I would add that this is obviously, we get kind of comfortable in this sort of new normal, and we maybe get a little bit, not as careful. And I think we get a little too close sometimes, or, those types of things. So I think that's great to revisit it.
I have to say I've gotten a little comfortable, and we also have to get a thinner or a thicker skin. It's okay if somebody comes to me and says, "Can you give me a little more feet here?" If we're talking, So we also have to be aware of other people. So remember, we need to educate employees, staff, people around us. Know their sick policies. Know your symptoms of COVID-19, because again, you want anybody with symptoms out of the picture. We don't want to have these people out in the community. So you don't want to have anybody with a cough, sore throat, shortness of breath, fever, lethargy, vomiting, diarrhea. There's a list of them. The only one I haven't found as a symptom is my allergy, itchy eyes. Seems to still tell me if I have itchy eyes, they're my allergies. Also review with your employees, what do you do if you test positive or if they've been exposed, frequent hand washing. You may have different employees now than when you put everything in place. And remember to show people the proper way to wear your mask. Saw a lot of people under the nose this weekend. Not how it works. It goes over the nose on the bridge. Next slide. So this is still under that first leg. Also remember what COVID-19, it is a virus. It's a disease caused by a respiratory virus. It has to go through your upper respiratory tract. This is so key for people that I find still now they don't understand. If you eat it, not going to happen. It has to go through either your eyes, your nose, or your respiratory tract through your mouth. So you can get this, and for those who weren't on the meeting before, COVID-19 is really easy. It stands for coronavirus, COV, infection, disease. 19 is the year it came out. That's what COVID-19 is. Classically, it's the disease where SARS-CoV-2 is the virus. But I'm going to tell you, even the doctors, we've mixed them up so many times. Your spike protein, the thing on there that looks like a horn, is what they're making the antibodies against, which has not, it appears, to mutated much. So that's really good because since they've been hanging their hat on that for the vaccine, that looks really good. So next slide. So if it's a virus, how do you get it? You get it through droplets. They can be bigger droplets that may land on a table or on the railing. You put it in your hand, you pick it up, you don't get it on your hand. You don't get it from just being on your hand. You'd have to take that hand, put it to your face, put it to your eyes, your nose, or your mouth, and take it in. Initially, when this illness came about, we thought it was large droplets and that the direct contact was the key. I'm going to tell you, they turned out to be smaller, more airborne. We still know it can get in direct contact, but the main goal is airborne. So direct contact still keep everything clean, but as you know, we're talking about washing the hands, but not as much as we're talking about 6 foot distancing and mask. So you get it airborne and you can get it by direct contact. Put your money on airborne most of the time. Okay, next slide. Airborne, First of all, let's go back. If they're sick, they need to be out of the community. They need to be at home. This is because, and Vicki alluded to, viral load. When you are breathing, you breathe out your air and you breathe in other people's air. If they have the illness and they are coughing or sneezing or laughing or singing, more virus will come out and more virus you can take in. If I am healthy and I'm doing well, and I breathe in some of this SARS-CoV-2 virus, my body says, hey, Dr. Bergman, we're on board. Your army for this, we've got you covered. You didn't get much of a viral load. We've got it covered. So I can literally take in some virus and not get sick because I have an immune system that can fight it off. And it doesn't mean I've been vaccinated or anything like that. It's just a small viral load. I don't get sick. But the opposite is also true. If somebody coughs in my face, and I take in a large viral load, my immune system says, ooh, overwhelmed your army here. It got past us. It's now down in your lungs. You're set up now to get the illness. So that's why we talk about viral load. That's why we want everybody with symptoms out of the picture, because when they breathe it out, when they cough, when they sneeze, when they are talking or laughing, they have more virus in their breath, and you're going to take in more virus then. If you are asymptomatic, pre-symptomatic, or non-symptomatic, which means you have the virus in you, but you're not showing any symptoms yet, usually the viral load is much, much less. So that's when we're talking about wear a mask, social distance. We're talking about people who have no symptoms and are putting out smaller amounts of viral load. So if people are putting out large amounts of viral load, that's because they have symptoms. We want them to be at home. Even if they're not coughing, if they just have a fever, we want them out of the community, one, taking care of themselves, and two, keeping from spreading it to others. So
Mary, I have a question about that. If I'm exposed over time, does that mean that my body is going to be eventually immune to it?
No good data on that yet. The real thought, though, is that no, you're not immune to it, because the initial defense mechanism that you have in your upper respiratory tree does not give you the ability to make antibodies and the memory to make antibodies. It's more of a blocking defense instead of a long-term defense.
Sorry, that was just a plant.
Okay. So now we're talking about how do you stop airborne transmission? Wearing a mask. Wearing a mask really does help. But again, you got to wear it properly. Social distancing does help. I'm going to tell you, 6 feet is good, 8 feet is better, 10 feet is best. The further you can get away from somebody's breath, the better it is. So if I'm talking to somebody on my deck, I don't do 6 feet. I do a little more than 6 feet. I kind of give it as much as I can so we can still hear each other. So 6 feet is what they say, but remember, 8 feet is better and 10 feet is even greater. Limit time. Why do we say limit time? You know, we talk a lot about wearing a mask, washing your hands, and social distancing, but the next two, there's data out there on these, and time is important because of, if I'm talking to someone with I'd say I'm having coffee with Cheryl, and we're now without masks because we're drinking coffee. And we were only maybe there for 2 to 3 minutes. We're pretty good. My body says, I got it. If she had that virus, I've got it. But if we've been talking now for a half an hour, my body's gotten virus after virus after virus if she's spreading it. And now my body's been overwhelmed. It's like different lines of defense. It has just overwhelmed me. So time is really important. You don't seem to find that you get the virus spread when you're on a jogging track or that, and you just pass somebody. It's when you stop and talk to that person for a long time. That's important. I've been trying to get friends now that the pool's closed, that when we're out and we're either walking or jogging or whatever we're doing, and I understand a lot of people cannot have a mask on when they're jogging, that I get. But then when you're passing them, don't take a breath. Don't talk to them, wave. We need to learn right now. We don't want to breathe in that other person's breath. So if they can't have it, hold your breath until you're past them. That's it. It's just a good way to go. Yes, Cheryl.
Question. So if I'm working in a store, or let's say I'm working in a tasting room and I'm next to somebody who also has a mask on and we're working all day long, does that put me at a greater risk? If I'm working a 5 to 6 or 7 hours, or maybe just even an hour, and I'm standing next to that person working and I've got my mask on?
Well, I would say try to do the next thing we're going to talk about at the same time, because it does give you an added risk. Our masks are good. They're not perfect. They're not medical masks. So yes, the longer you are, even with a mask, it is. But I'm going to tell you, if you're working with somebody, don't work in front of them like you're just here talking, like we're talking, looking at the computer. Work shoulder to shoulder. Because if you work shoulder to shoulder, your breath is going out in front of you, their breath is going out in front of you, and you're not going to get it. I really like to think about airflow. We talked about outside is better than in. Yes, absolutely. Outside is better than in. Okay, now we have to be inside. How can we better do our inside? Get away from being face to face. Really try to not talk to someone's in their face. What I would say to do, and I've done this at Thriftway, is take a step to the right. You know, just get out of their face. You're still there in front of them, but my breath is going past their ear. Their breath is going past my ear. We could be 6 feet apart. We can have masks on, but I just gave myself another layer of safety not to get this airborne transmission. And again, you hear, if you went to my earlier talks, I really pushed this airborne transmission because this is how it spread. And if we always think of wear a mask, social distance, limit our time, and consider the airflow, we are just so much better about not getting this disease.
And so, Mary, I'm sitting here thinking, if I'm Eli, how do I think about things?
Oh, absolutely. If you're talking to a patient.
I thought you might have a question, Eli, because I saw you come back on video.
Right. Yeah.
Okay.
So let me ask you the question. So I now have N95s. Okay.
Great.
How much more? I mean, I've had them for months actually, but now I've been able to access tons more. So how much more protection? Well, number one, there's a few things I do that are really important. One is an N95. So I'm curious how much more protection N95 gives me and my patient especially. And number one. Number two, limit time. So I run in and out. Like, luckily at this point, I don't have to stay in a room for an hour. I try to get out within 10 minutes, literally. And I also have consider airflow. I have a HEPA filter going before, time in between people, clean everything, and then turn that filter on, plus the airflow in the room that comes with the room. And so far, I mean, I feel pretty comfortable about it, but I just wanted to get your take on the N95 and the time limit. My understanding, 15 minutes is the most.
I think all the things you put in place are awesome. I mean, they're excellent. N95s are definitely better than our handmade ones, handmade masks. It's hard for me to tell you exactly how much better because, you know, each handmade mask are different.
Right.
You really want to see, I'm going to tell you, and you being a provider, you know this, get it fit right. That's the key on an N95 is how well it's fitted to your face. And that's important. The filters are really good to have. What we're finding is when you're talking to a patient or a customer, it's their breath that's coming at you right now. The filter really cleans the room, which is really good, but you've got to be careful in your conversation with them right then and there because the filter's not in between you two. His breath or their breath are coming to you. Time is important. If you can cut it shorter than 15 minutes is great. even when you're sitting there talking to them, if you can come to the side so that you're not directly in front of them, so that it passes, their breath passes you by is good. And if you can stretch it out from 6 feet to 8 feet, that even works. So
I mean, I've been doing all of the above from
great.
from the beginning. Actually, I stopped working for a bit to figure it out, and I've implemented all these things.
Mm-hmm.
Thank you.
Great. Okay, next slide. This is really, you hear me say this all the time. This is the hardest thing for me to do, is not touch my face. I have allergies, and oh my God. So you're only going to get, if you're picking up the droplets from the handrail or that, you're only going to get ill from it if you touch your face. So yes, we need to be completely washing our hands, but if we can keep from touching our face. So what do I do? As soon as I come in the house, I'm washing my hands, so that, because my hands are going to go to my face and itch my eyes, and that's the key. And we can do that. I love having gloves now because it's cold outside, so I don't seem to touch my face as much with my gloves on. So next slide. Okay, this is to remind everybody, sanitizer is really good. I have it in my car. We use it all the time, but soap and water is better. So if you can, wash with soap and water. Remember, you do it as long as you can sing happy birthday, because then it really gets it good. But in between times, use sanitizer. It's still good. Next slide. Okay, so that was strategy 1. Go over the old information, get all your preventative stuff in place, because what Vashon businesses have found out, that those who have had a positive case, it hasn't spread. And this is the brilliance of this. It hasn't spread so far. It may spread in their communities, but this is really, really good. If you do your prep work, like we're talking about, it will get better. That you can get up and running a lot sooner when you don't have a spread. If you have a spread in your office or your workplace or your restaurant or that, then that clock starts all over again. And that's a scary thing. So strategy 2, the second leg of that, the stool, team COVID-19, create a team, have somebody develop a preparedness. You've got a positive, okay, who do they call? Find out, okay, who's your point person? What's that phone number that they call at your business? Okay, does that point person have a list of everybody's schedule? Does the point person have a list of everybody's phone number, how to reach them? Create just in case documents. Okay, just in case we get one, who's in charge of the cleaning that we're going to talk about later? Okay, who's in charge of maybe talking to the media, maybe just talking to each individual employee, who's in charge of looking at videos and the check-ins, the logs, the schedules. You know, you want to give people roles, not create them when you get a positive case. You want to have this all put together already. Really get to think, when I get a positive, this is what I do. And a point person, I think, is the key, because you really need a point person. Who's the person? Tell your employee, you get a symptom, you have to stay home for a fever, you're out, you were tested, we're in a pending, we don't know the test result, who are you going to call? And the answer is not Ghostbusters. It's got to be somebody that they trust, and somebody in your community, in your team, that everybody feels comfortable with. The person who's the COVID team leader, look at the guidelines, kind of follow the guidelines, because things change. We're going to talk about some of the changes and why they kind of changed, and know the current COVID status on the island. I think that's really key. So create a COVID-19 team. We talked about this when we were in the reopening. It wasn't as real then, because I think we felt really comfortable and we're doing so much outside. Now it's real. Now it's real, and we've got to put this team together. Any work you do before you get a positive is going to save you in the long run. It's really going to help. So team COVID-19, if you decide it's going to be you and your team, try to find other parts of your job that you can offload to other people, so you're just not tacking on more work for yourself. Okay, next slide. Okay, so strategy 3 is to know and follow the guidelines. This is where I get to tell you bad news. The guidelines aren't very nice. They're not black and white. There's a lot of gray zones. There's a lot of muckiness about them. It's difficult to follow because these are guidelines for everybody. And as you know, a primary care provider versus a real estate person versus a restaurant, they have all different specific needs and guidelines. And this is hard. It really is. So this is when I'm going to tell you, go back to that 1-844-469-4554 number and get some help and advice, because they're going to be there to walk you through these gray areas, these muckiness. But we're going to go over these guidelines. I'm going to tell you that if you do strategy 1 and 2 well, it's easier to go with these guidelines because you'll have somebody helping you and you'll have all the answers to the questions that the MRC is going to be asking you. And please realize these are local people with the MRC who know what they're doing, who understand confidentiality. Next slide. Okay, so let's go over some of these guidelines. Okay. So as an employer, what do you have to report? This was a surprise to me when I first learned about it in the early years of this illness. I thought every time you got a positive, you would have to report it, but you don't. You report if you have what you think of as a spread, and that is more than 2. So if you get more than 2 employees in a period of 14 days, you have to report it. You have to, and there are areas that you report it to. However, if you think it's spreading, say that you had a positive case and now you have 3 other people out with a fever and their tests are pending, I would report that. That looks like a spread. So you're really looking at, they want to know if they think it's spreading. Or was it just one person and you haven't had any spread? They don't need to know about it. Would I say you don't need to call the MRC? No, I'd call the MRC because they're going to help you walk through it to make sure you're doing everything right. But you don't have to adhere to the Safe Start proclamation. The big thing here, and I'll get to you in a minute, Vicki, is the public health department's getting overwhelmed. And they had, I talked to somebody that had 3 people in their home that were positive, 2 children, the father and the mother was not positive as of the time I talked to him. And I said, oh, he said, we think we got it from one of the kids. And they all had symptoms, came down at different times, so it probably spread within it. And they said, I said, well, have you been contacted for a tracer or anything? Because there's 3 right there. And he said, well, isn't that funny? You're only the second person who asked me that. My other one was our primary care provider. And no, we've had no contact. No tracer person has called them. So what I'm going to tell you is there's a system that is getting overwhelmed already. Our numbers are going to be going up. You are in a good place. You're on this island who has help for you. And that's through the Vashon BePrepared and the MRC and that number I gave you. So hang in there. You're not going to be out on your own on this. There's people here to help. Vicki, what did you want to say?
Yeah, sorry. You said more than 2 employees, and it actually is 2 or more. And the other thing for people to know is, of course, when there's a positive test, that does get reported to public health. So that's one way they already know. But yeah, there's some very sad stories about the situation with contact tracing.
Thank you for correcting that, because that was a misspoke on my part. It's 2 or more. Once you get 2, you should be reporting it in. 2 within 14 days. 2 or more within 14 days. But if you have 1 and you have people with symptoms and they're pretty strong symptoms who are waiting for a test, then it looks like you're getting a spread and you should be contacting them also. But you could also call the MRC and find out what they think on it. Next slide. Are you going to find out that I am so excited about this phone number, and that you have help out there, and that we live on Vashon Island? I just think it's so cool. So employer responsibilities, screen your workers before the start of work. I think that's so important. I just can't tell you. We can't slack off on that. Yes, it's being spread by asymptomatic people a lot, but we know with a viral load is higher in people with symptoms. So if you can keep people with symptoms out of the workplace, remember, screen your people before they come into your work business. And I also am a believer in screening with temperatures, because I think 100.4 it's hidden. I could have 100.4 and I don't know I have a temperature. It can be the first sign, and it can be the first symptom. It's a symptom, not a sign, that you're starting the illness. So I think a temperature is good. It doesn't mean you've gotten everybody, because we know you could still have spread, but it means that you've at least taken the high viral load people out of the picture. And then also, you're also still required to follow all the current guidelines, the mask, the distancing, the clean, the temperatures, things like that. Remember that the current guidelines change. Team COVID, your COVID-19 team lead, keep abreast of all the current guidelines. Next slide. Okay, so this is why most of you probably came. What are you going to do? Step one, what are you going to do? Your employee is either suspected, has a fever, you send him home, or he's positive, she or he is positive for COVID-19. If they showed up for work, you didn't bring them into your place of business, you caught it ahead of time, you're sending them to a safe place. When I say safe place, I mean, hopefully they don't have 5 other family members in their home. Hopefully they can isolate to a specific room. You really need to tell them to stay away from everyone else, because they're positive, they have a higher viral load, and they can spread it easier. It's not easy, but again, there's people out there to help you. Vashon BePrepared can help with us. They can get you in touch with food supply. They can get you in touch with how to get tested. They can, they have all the resources that can make sure that if you're sending someone home, that they're going to what I call a safe place. We have had people who have gone to their homes, quarantined in their home with their family, and who got it? The people in their family. And this is because they didn't understand or weren't able to safely isolate from the other people who were not exposed, but now they are exposed because you brought it to them. The 2 different words that we use a lot, and unfortunately we're kind of using them interchangeably, quarantine and isolate, they do have different meanings. Isolate means you have the illness, and it looks like you are going to be able to spread it to people. That's isolate. Quarantine is you've been exposed and you are at risk for having it. But you're going to see media, even physicians, we've mucked up those words and we use them interchangeably. I usually think of isolate, begins with an I, means you're infected, begins with an I. That's how I remember. Isolate, you're infected. So you strongly encourage employees to get tested. Can you mandate they be tested? No. I can tell you, I'm an older doc, so went through HIV scare in the early years in Dallas, Texas. You can't mandate that. You can't even mandate that they stay in a safe place or stay home. You can help them in every way you can. You can mandate that they not come into your place of business, because that's yours. So I think with the more support we give people and the less stigma we put on this illness, that we can get away from people saying, I'm not going to get tested. I don't want to know. We need to go with knowledge. Proceed with knowledge is the key. There's testing on the island, there's testing off island. And again, that phone number can help you find out where to go. Employees should be tested 48 hours or later from last exposure. This is where, say Cheryl and I were together and Cheryl turned out positive. Okay, we were together this morning. She calls me in the afternoon. She says, oh my God, I just had a fever and they told me I'm positive. Should I go test it right away? No, because I will be negative. My body hasn't had time to take that virus and the virus start producing and getting more and more and more. You need to give it a little bit, at least 48 hours to grow, to get enough virus in your body to come up with a positive test. So if I went to get a test on the day that I saw her, it's a wasted test. It would give me false security if it was negative. So wait at least 48 hours. I'm going to even tell you, I think it's safer to go in quarantine and do it later at like maybe 4 or 5 days out, because then you're having a better response. Your body now has had time to grow that virus. And if it grew that virus, now your test is going to be more accurate. Now, if I saw Cheryl, she was positive, day 3, I started having symptoms, then I can go be tested, because if I'm having symptoms, I have a higher viral load now, and I'll probably be positive. But you don't want to get a false sense of security. Is it a false negative test if I got it at 24 hours? No, it's a true negative. I didn't have enough virus in me, but the virus is in me and it's growing and it's multiplying, and it's just I did it too early. So that's the 48 hours. The other thing about the 48 hours, say she tested positive today, Cheryl did. Cheryl, I'm sorry, you have the illness now. She should go back 48 hours before that and talk to people that she might have exposed prior to. So don't just think of when she came out with the symptoms, because remember, she probably had the virus 2 days prior to her symptoms, at least 2 days prior to her symptoms. And the virus was just growing and multiplying and growing more. And then the symptoms started. That's kind of why there's, and we'll get into it later, 10 days versus 14 days, whether you have the symptoms or whether you've just been exposed. But so prior to her testing positive, she was incubating that virus and it was growing and growing and growing. And now she's more, now she's got the signs and symptoms of the illness. Does that make sense? Why you have to go back prior to? Because she can still get it, give it to people. She's spreading it, but it's at a lower viral load, but she can still spread it out there.
And so, Mary, I get a call from, because, you know, now I've got it, but I got it from, you know, somebody I was working with maybe. And should those people, or those people I was around, maybe I didn't know I had it for those 2 days, or that I didn't know I had it and I was working with other people, should those people isolate then for those 2 days before they get the test?
I would, but remember, they're 2 days out now from when they saw you. So they can be tested probably in a day or 2. Yes.
But in the meantime, they're walking around and potentially could be
yes,
exposing other people.
Right.
So they really need
so you want to quarantine them away
from
from other people. That's at 48 hours. You want to quarantine them away, and but they get to get tested sooner than me because I had just seen you recently. Their risk is going to be less because you had less of a viral load. That you were breathing out less viruses, but viral particles, or fomites as we'll call them. You were breathing out less, they have less of a risk, but they're still at risk. And so that's important. Okay. Okay, if 2 or more test positive, we went over that. Notify your local health department. Provide sick leave and benefit information. Yeah, your employees need to know this. And then your point of contact, you'll see I call that POC. Your point of contact business person needs to be the one really running the show when you get a positive, because they're going to learn how to talk to people, how to keep confidentiality, how to really work with this.
And Mary, one other question I have for you, you say, you know, notify your local health department, because we are so lucky to have the MRC here on Vashon. If we had 2 and more employees who tested positive in a 14-day period, probably be good to call them too, wouldn't it?
Oh God, yes, yes. I think anything you can be doing to be as transparent as possible. Yeah, the MRC is a gift, and we have to make sure that they have the information they need to continue to do their work. And Vicki, if I say MRC and it should have been Vashon BePrepared or one of the other groups, I apologize. I kind of put them all together as our big group of guardian angels.
I know it's not easy for people to understand the difference. It's fine. It's actually the Emergency Operations Center and the Medical Reserve Corps, but that's another discussion.
Okay, thank
It's all
you.
right. It's okay.
Okay, so what are you going to talk to, what's the guidance for employees who are suspected or positive? And employees who test positive cannot return to work until after an isolation period. Okay, so this is 10 days after their symptoms started. 10 days after their symptoms started would probably be 12 to 14 days from when they first got the infection. Because remember, your symptoms lag from the time that you get the virus. So that's why if you have symptoms, it's 10 days. If you are exposed to somebody, it's 14 days, because the people with symptoms already backtracked, and probably 2 to 4 days prior to their symptoms, they already started having the infection and the virus was growing and growing and growing. But it's not just a flat 10 days. You have to have other qualifiers. It's 10 days since you started your symptoms. It's at least 24-hour non-medicated fever-free. That means that on day 9, if you decided, okay, 10 days is coming up, so I'm going to load up with Tylenol and some Advil in that to keep my fever down, that does not count. You have to be medication free from any of the febrile or fever reducing medications. And that's really important. So if you're taking Advil because you have aches and pains, that could keep your fever down. We really want to see a true 24 hours of no fever. And I think I'm a pediatrician, I'm also a mom, and I used to get these questions all the time. How come Joey goes to daycare and by 1 o'clock he has a fever, but he's afebrile when he gets there? Well, mother needed to go to work, so she loaded him up with Tylenol and she subdued that fever. So remember, if we take the fever down, that's not a good thing to do. We need to let the fever show if it's going to be there in that last 24-hour period. The other thing is, can you come back if you still have some symptoms? Aches and pains, some cough? Yes, you can, but you need to be improving. You have to show a strong sign of improvement. You also are going to have to be wearing a mask. You're going to have to stay distance from people and all that. But that's the key here. If you're coming back to work, it's got to be a minimum of 10 days after the symptoms started. You have to have a minimum of the last 24 hours of being fever-free without meds. And you have to show clearly that your other symptoms have been improving. And please remember, those are all 3 caveats need to be addressed, not just one. Okay. Then you have to also identify workers or clients who may have been exposed. Your key point person has to really know how to talk to people, because it's a difficult conversation to have, especially if the person who is positive says, you can't use my name, I don't want anybody to know. And so now you got to go and say, I got to tell you that you've been in contact with somebody. And so please make sure that your person who's going to be talking to these people really understand the ins and outs of how to carry this off without putting any blame on anybody, without having any strong issues between people. So who are people who might have been exposed? It's anybody who's been in 6 feet of a person who is COVID-19 for at least 15 minutes. That's that 15 minutes I was telling you about. You know, if you can do it, if you can have people talk for only maybe 5 minutes, if you can have people do things by computer to each other and then end up just finishing out for a minute or 2. If you can have people instead of in front of each other going side by side, that's really going to decrease people's close contact. And that's the key. You really want to do it. And I have to tell you, they're now saying 15 minutes can be accumulative. That's kind of new. So if it was 5 minutes now, 5 minutes, 15 minutes from now, 5 minutes, an hour from now, they're going to say you hit your 15 minutes. I think they're going to have to put a time frame in there, because your body's defense system doesn't really act that way so much. I think if you met somebody for 5 minutes, 2 hours later, you met them for 5 minutes, and 4 hours later, you met them for 5 minutes, you shouldn't be adding up to 15 minutes. But that's where I'm going to tell you it's gray. And I'm keeping an eye on that data to see if anybody's putting out any good data. And I haven't seen anybody. And I looked this morning to see if there was any good data on that. But 15 minutes is supposedly the key. A person is contagious, here you go, 2 days before their illness or symptoms are onset. That means, remember, you go back 10 days, okay, 12 days, maybe even 14 days. So if it's an asymptomatic patient, you go back 2 days before their positive test was collected. Now, could we be missing some there? You can. They had to come up with a time, so they came up with 2 days. What if I turned out positive, but on Friday, but I might have been positive on Monday and I didn't know it? And here I'm only going back in my time frame to Wednesday. So kind of talk to people to really find out if they're asymptomatic. The best thing is if they're asymptomatic, could you figure out who you got it from? You know, because that can clue you in on how far back to go. But right now they're saying 2 days prior to the positive test. And that's just a numbers game, trying to figure out the most people that they can look into for finding out if it was passed on to anybody. The other thing to do, and this is your point of care person, your COVID team leader, review logs. I know at the VCA that you sign in the time. That's brilliant. I know when I swim at the pool, the parks pool, you had set scheduled times. There's databases. There are people that might have videos. Interview employees to find out who their contacts are. I like this also. Initially, they were going just with the person who was positive. They were asking them, okay, who have you been in contact with? But I also think we need to talk to the other employees because your memory could be different. Oh my God, I forgot I had that water cooler talk with somebody, you know? So the more we can be transparent, the better it is because the more data you're gonna get. So the more people you let this information allowed to go out to is best. And that's key. Transparency is really important. Next slide. Is this making sense or am I just rambling? Okay. Communicate to exposed employees. Again, this is really hard. You have to inform the employees that were exposed, but you got to maintain confidentiality. That's the law. Now, what if Cheryl got it and then they called me and she said, oh God, Mary, tell Mary it's me. Tell Mary it's me. It's still pretty touchy. And I'm going to tell you as a physician, it's still pretty touchy, but Cheryl can call me and tell me. So I would like to tell people that if you're positive and you know you were in contact with somebody tonight, you know, see if you couldn't have that conversation with them because that's really good. If people really feel strongly that Cheryl's saying, I can't call Mary, I'm sick, I really want to stay in bed, I just, you know, I want to lay in bed and moan and groan for a while, then I would say, and this is a personal thing for being a medical director, I'd say, get at least 2 people on that phone call with Cheryl. Let her say, yes, she can call this person, and this person, and tell them I was positive. Get clearly 2 people hearing it and documenting it, and get exactly who she is allowing you to give information to. That's the key. The law is you maintain confidentiality. It can be broken with release from the patient. Okay. Instruct employees with close contact to stay home for 14 days. This is back to why is it the person who is positive only has to stay in isolation for 14 days, but the person who now has just been exposed has to go for 14 days. This is because the person who tested positive or who has symptoms really had the illness prior to that point. But when you're exposed, you start your clock. So that's why 14 days for exposure, 10 days for a positive COVID test or start of symptoms. However, the CDC has now come out with some new suggestions, and I'm going to say suggestions. The data has not changed, and I'm going to be really strong about this. The data has not changed. There still is a chance that on day 10, you may be asymptomatic and you can start symptoms. Here you've been in quarantine for 10 days, and now on day 10, you start having a fever. It's not high. The highest risk is usually between, we'll say 4 to 7 days after you've been exposed. That's your highest chance of starting to have symptoms. But that chance of having symptoms doesn't go down to 0 at day 7. It goes down to 0 closer to day 14. So it's called what we call a tail. It's much lower in risk, but there's this tail that kind of just keeps going on until day 14. So they've always said 14 days. The data is out there that still says that. But they were finding, the CDC, that a lot of people were going, I can't quarantine for 14 days. There's just no way I can do this. So they came up with some other options. Other options is if someone says they refuse to quarantine for 14 days, this is what they would suggest to do. Okay, quarantine for 10. No testing or no testing needed at 10, but you cannot have any symptoms. All rules are broken if you start having symptoms. So they're saying if you cannot quarantine for 14 days, then do it for 10, and you can be released of your quarantine if you have no symptoms without testing.
Okay, Vicki, go ahead. Vicki, I know you've got your hand up.
Thank you. I just wanted to say I put a couple of useful timeline type images in the chat.
Okay, great. And thanks, Vicki, because the way I have y'all squares, you're covering up my chat box, so I can't see it. So thank you for saying that. The last one is, if you do have testing, go with day 7. And at day 7, if you test negative and you have no symptoms, you can be released from quarantine. My preference, and I believe it also is the MRC's and the Vashon BePrepared, is 14 days. The data still stresses 14 days. But if you can't do 14 days, 10 without testing and no symptoms, or 7 with a negative test and no symptoms. But remember, this is only for no symptoms. We need to make sure people understand this is only for no symptoms. Did that answer, Ellie, your the changes the CDC put out?
Yes. You mean, I understand that, but I'll just give you just FYI is like, so, I mean, I sleep in the same bed with my wife, and if she was, let's say, positive 2 to 4 days before, so what this is assuming that my exposure is after the fact, around those 2 days. So, I mean, I actually was exposed in this particular case. I mean, I agree in the bigger sense, if as an employee walks in the door and they're exposed 2 days before that person is positive. But in my case, it's actually, I mean, I was more exposed. The minute she was positive, I stopped being with her, right? So.
But you had ongoing exposure. So you had ongoing exposure.
Well, yeah, for at least, the whole time until the moment she was positive. Actually, until the moment we got the results, which was Monday. So, yeah. She got a positive. I mean, she took the test Saturday. So, you know what I mean? So there's wiggle room. I see wiggle room here. And I haven't had any symptoms, neither she though. But
and my feeling on this is because you had ongoing exposure before she tested positive, I go with 14 days. And I know that's a pain. That really is nasty. But your body got repeated viral loads, and you were getting higher viral loads as she was getting closer to testing positive.
Sure.
Yeah, but I will keep my fingers crossed for you and her still. Okay, next slide.
Better to be safe than sorry, right, Mary? That's
Yeah.
why 14 is so a good number to remember.
And we keep telling people the data didn't change. This is just, the data's still the same. Okay, so step 4, communication to employees not in direct contact with individuals or your customers or your patients, So these are people that really don't look like they're exposed. They don't need to go in quarantine. What do you need to tell them? It is our firm belief that being transparent while maintaining confidentiality is important. explaining everything you've done to reduce transmission, reinforcing the actions that you've taken to be safe, and providing your staff and your point of care person a place that they can call to answer questions and that, because they may come back and say, you know, I know some person's out, and I had a fireside chat with him, and we were sipping some nashi, and we didn't have mask on, and this was my date. Am I exposed? You can do it without telling them who it is, because they can tell you, and you can say, no, it did not fall in any timeline or right person or whatever you want to do. You can answer people's needs. I'm going to tell you that having transparency, the businesses on the island who have come out and said, we've had a positive, this is what we've done, have benefited them. People have gone back to them because they came out and said that they were positive, and because they did everything right. I'll tell you, my husband and I go to the dentist with Mark Langland, and he had a follow-up appointment with him. And was he going to go? Yes, he went, because they were upfront. When they were positive, they told everybody they did everything right. So when they were open, you knew they were doing everything right. They didn't come back out. We get food from Sugar Shack. Sugar Shack did the same thing. We got an email saying everything that they've done. It gave us a really strong sense of they're doing things right. I'm supporting them. So all of the businesses that have come out have found out that they got so much support from the community, because the community feels like with data, you now know how to move forward. I'm a big data person. I live with data. This is the key. If you give people data, they can make good decisions. So hiding things doesn't work. You hide something and then it comes out. Oh my God, then when do people trust you? They don't know to trust you or not. When you come out and being transparent, I think is key. Again, if we can take the stigma off of this, I think it would be really helpful. Then people aren't going to be so sad. You've mentioned, Ellie, your wife has it. The fact that he's saying it, it's here, it's in my home. I now know it's real. And it's very comforting, not because I want him sick, but because it happens to real people, and it's us. And this is what we need to remember. You know, if I know a neighbor has it, I can help. I can drop off newspapers. I can take them food. I can do things like that. We're a community here that's so strong that hiding isn't the key. Transparency is. So I'm a big one for being transparent, explaining the steps you've done, reinforcing, and providing the staff and everybody with good information.
No, totally agree. You know, my wife's also a lunch lady. She works at the school district, and that's why the whole program's been shut down. But it was really kind of fluky that she got tested even. She didn't have to. So it was kind of a miracle, the whole thing. Between her and me, we could have exposed a whole bunch of people. So we're very grateful, actually.
Thank goodness.
It's scary though to get that positive test. I can only imagine what your family's going through, because it's not a fun thing to know not knowing what the future holds.
And
Next
Mary,
slide.
I'm going to be the timekeeper. We got 15 minutes, so we got to kind of.
We're at the end, aren't we?
The last couple.
All right.
Ready for the next one?
Yep.
Okay, gotcha.
Thanks. Okay, just disinfecting and cleaning. There's a lot of questions about this. Remember, you can get this two different ways. You can get it airborne, or you can get it through droplets. So when you're talking about cleaning and disinfecting, you're talking about droplets. So first of all, if you have an employee that's going to be cleaning up, please make sure that they do not touch their face. This is when I would say put a face shield on them, so it would block them from touching their face. Always clean before you disinfect. That means get all the mud and the dirt and everything up first, then disinfect. When do you disinfect? If you know somebody was there today and they tested positive, then don't go in that room for 24 hours. Have it non-available to anybody. After 24 hours, then you can send some cleaning group in there with disinfecting. There on the website, there's specific items you can disinfect with. Also note that there is a, and this, I was looking right before, I couldn't find it. There's a site that says list N, put in the lot number of your cleanings or disinfecting solution, because it is, I can't believe this, but there's some people out there selling some stuff that looks like the real thing, but it turns out it's got the wrong number or that, and it's not. So definitely go online. I'll find it and get it out to all you guys, because it ends with list and you put in the code number and it'll tell you if it's real or not. Anything that has not been touched in 7 days usually is clean. The virus doesn't last 7 days outside of a sick person. Try, if you have an area that somebody was working in, to open windows, get air circulation, get HEPA filters and that, because you really want that to be dissipated. You want to take the virus that might have been in the air and have it go and dilute it out into the outside air would be the best. Other actions, remember, pre-screen all workers for symptoms prior to each day's work. This is so important. Have a single way to come in and out, so that don't bring them into your work until they've been screened. Maintain a list so that of exposed people. This is important. Be prepared to show this with contact tracers or that. They may come, they may not. I've heard that the health department is going to scale back a lot of their contact tracers and put them into giving vaccines. They have a limited amount of money, a limited amount of people, and they're trying to do the best we can. We are in good shape. We have the Vashon BePrepared and the MRC. Stay attuned to public awareness. Sign up if you're not already signed up for the SITS report, the situation report. Nothing better than getting that and knowing what's going on.
And Mary, Vicki had a comment.
Yeah,
Oh,
just
Vicki.
wanted to say that we are doing contact tracing on Vashon through the MRC. If you get a positive test through the MRC testing program, they will do contact tracing with you, very interactive and very private. If you get a test that's positive that's off island, they won't be aware of it. So you can still contact them and ask them for their help with contact tracing if you would like it, or for any kind of advice.
And that goes back to that same phone number, right, Vicki?
Correct.
Okay, that phone number,
I will tell you, Mary, in June, when we had one of our employees get COVID, we did get a call from the health department.
Oh, good.
Right
In June,
away.
they weren't overwhelmed yet.
And they're not
Exactly.
pulling them for
Exactly.
vaccines. Yeah.
And
Yeah.
you know, we hadn't been exposed to her because we weren't working with her, so the timing worked out fine, and the health. But I did want to let you know that the health department did in fact call.
There was also a misunderstanding in the community about the extremely high cost of the test. And I just want to make sure everybody shares with employees and friends and whatever that, oh dear, that the test is free, because either it's covered by your insurance, or if you don't have insurance or it doesn't cover it, then Vashon BePrepared covers it. So either way, it's free to everybody on Vashon, residents and workers.
And just because we're on this other action slide, I have to say that, you know, public awareness and, you know, that whole piece about being transparent is so important. But I will also tell you, we are, again, because we're on Vashon, so fortunate that we have Rick Wallace and the MRC team, because Rick really understands public relations and really knows how to do an effective job of communicating to our community, and is right there to help across all the different pieces. So whether it's the social media messaging, it's the SIT report, it's the messaging to your customers, the MRC is great on the testing front and the tracing front. And we also have the benefit of having somebody who has such amazing skills like Rick Wallace to help us on the public relations front. And I just can't emphasize enough how important it is to get them involved if you have, you know, a business that you need to communicate larger. I'm just thinking like John, you know, if VCA or Windermere or something like that. I think it would really be, we'd be really in great shape here. And as Vicki just noted, Washington Notify is also great. And all of this can be done in a very confidential manner, being very respectful of people's privacy and doing it appropriately, but also making the public feel comfortable that you're doing the right thing as a business.
I want to add to that, though, too, that the healthcare providers with the either the physicians or nurse practitioners or that, oh my God, we've got some of the best on this island that really understand this and know how to do this. This is such a gift. They are brilliant at this. And so I'd strongly recommend talking to them and even having the your case talk to them, because they can really walk you through it. And they also understand confidentiality. And that's a comfort to everybody. So, okay.
Yep. And Mary, so speaking of which, here's a quick video with Mark Langland and talking about sort of his situation. It's only a couple minutes, but it's really great to just hear somebody's perspective who's gone through this. I actually think that Vashon, a success story with Mark is a good title for this, because I do think that it was handled well.
Yeah, I do too.
Let's take a listen. Hopefully you can hear it.
That we had a positive inspection. First, after releasing a couple bad words, I was able to think clearly because we did have a plan in place.
COVID-19 isn't on the island. It's spreading. Businesses are going to have employees who test positive, and they should plan for it. The most important thing that Mark did occurred long before he got word that there was an exposure in his office or a positive patient in his office. The most important thing to organize his business so that nobody was in a position to transmit the virus, even if they were positive.
Yeah, the most helpful thing throughout this process with working with Vashon BePrepared is to help you with your unique situation. How you come out to the public about this is a major concern when you're a business owner. You know, there's two aspects when you have a business to running your business, and one is what you do for the community. And then the other is, remaining in business. And so you must balance these things, but this is really one of the best things you can do for the community is come out and be transparent. Vashon BePrepared, they really helped in that aspect. And I felt like they had my back in that they wanted what was best for the community, but they also wanted what's best for my business.
COVID is here and it's going to get worse before it gets better. So businesses really need to be prepared. They need to have a plan, and they need to not be on their back foot when it happens in their business. I mean, Mark's response was really exemplary. And it was great that was one of the first businesses to have cases on island, because it sort of showed how well it can work. We've had some other businesses that were interested in being less transparent, and I can speak from experience in saying that works a lot less well.
I saw no negative impacts to my business for being transparent. When people know that something has been dealt with correctly, they will come back.
It has uniformly been positive for businesses. We've seen all of the businesses that we've talked to and helped have been surprised by how gracious the community has been and how grateful they were for their transparency. Transparency for a business is really the key to getting through these episodes.
Being transparent actually aids, and that might be a little counterintuitive when you first get the call. You think that letting people know what happened might create panic, but in reality, when people know exactly if they were there and the timing, then they're going to be calm about it.
That transparency has another element to it that's really important, and that is because this is hard for everybody already. Most people who call us after a business has had an employee who tests positive don't need to be quarantined and don't need to be tested. But by being transparent and giving the MRC the information to be able to actually screen people who are concerned, most of the time we can reassure them. It would be helped if businesses reach out and ask for help. And that's one thing that the MRC has been doing for a number of island businesses, and I expect or hope will be an expanding activity over the course of the next couple of months.
Great. So really good testimonial from there about how it went. And I do think that that is definitely a Vashon success story.
When I got
Sorry, I got to move to the next slide or he'll start talking again. Mary, I think with 3 minutes left, I don't think we have much time for discussion, and we've been kind of discussing as we went. But I did want to give you this last slide and then remind everybody we had some new PPE and we reprinted signs in case people need them. But you want to take this one?
Sure. It is a probability that you're going to have somebody in your office or your staff come out positive. It is a probability. So I think that's the key. It's up to us. How it affects your business, think of strategies 1 or 2. How it affects your family or friends, which is the spread, is strategy 3. So my top 3 takeaways from this is that phone number. You're not here alone. Know that phone number. 2, create a COVID team, because then you can jump on it and you're ready to go. And 3, go back and re-look at everything you've done in the past, because they did so well at the places that didn't have spread because they were already strong in not spreading it. So that's my belief. Those are my top 3 takeaways. And we're also, if you send a question, we'll get you an answer, whether it's by a phone call or an email, whichever you prefer. But we're here to help. We're here to walk this pandemic with you.
Yep. Thank you, Mary. And I do want to just remind everybody, we did reprint our signages as the signs at the chamber office for pickup for free. And so help yourself. We got lots of them there in case the ones you had were tattered or maybe you didn't have a chance to get them before. They are available there for any businesses to take and put up. I think it's always a good reminder. And the thing I love about these signs is that they are bold and it is really easy to see from a distance. So if we have them up everywhere, it's a good reminder for everyone. The chamber is also in the process of purchasing additional PPE and sanitizer for businesses. So if you need that, please reach out to us, either executive director at vashon-chamber.com or to the board president at vashon-chamber.com. And so with that, I just wanted to say thanks. Aaron, John, thanks for hanging in there all the way to the end. Vicki, thank you so much for all the great tips. And of course, Mary, you're a rock star, and I so appreciate you taking the time to do this. This is recorded. It will be put up on the chamber website, and we have another one at 9:30 on Thursday in the AM, 9:30 AM, and we are sending a correction out. Although the registration did say AM, I think the email. It's what happens when you do them late at night. Anyway, that time zone thing and that AM thing, so overrated. Anyway, guys, thank you so much. I hope you guys have a good day. And with that, thanks for all the support.
Is Vicki, can I bend your ear for a minute or 2?
I can hang out.
Okay. Great.
Hold on 1 second, please.
Okay.